And now I'm talking to Breda Gahan from Concern. Breda, how's it going? Breda, I did an in-depth interview with you about your work on the global HIV/AIDS picture late last year. In the last couple of weeks, UNAIDS have released a couple of major reports, and the 2016 International Conference on AIDS was held all last week in South Africa. I understand that you were at the International Annual Conference on AIDS last week. Can you tell me what, if anything, you know on the global picture combating HIV and AIDS that you didn't know 2 weeks ago before the latest UNAIDS reports and international conference, please?
I guess I didn't. Thanks for the interview, Darren. It's really important to acknowledge the 21st International AIDS Conference. It's the 5th conference I've been at, but it's the first one that's been held on the African continent since the Durban AIDS Conference in year 2000, when sadly there was still denial by the president there about the issue and the health minister. So great progress has been made. But what staggers me is that the treatment gap is still so great. 17 million people needing treatment are currently on treatment globally. 19 million people still need to be reached with treatment. And most of the populations who are not accessing treatment belong to the groups that Concern works with, especially in Africa and Asia, the extreme poor. Their voices are not being heard at the international health conferences among the key populations who often have very strong voices, and good for them. But the extreme poor, I feel, are being left behind. And weakening health systems and conflict, especially in Africa, is undermining health workers' capacity to get treatment following testing to reach people.
Is it true to say that the reason why so many people are not receiving antiretroviral drugs for HIV is because they don't actually know that they have HIV? Or is it that there are any big gaps in the health services where there is a lack of resources to help people?
Yes, the majority of people who are not on treatment have never been tested, are living in remote rural areas or urban slums. Based on my last 2 Concern programme visits to Mozambique and Ethiopia, it was people in remote rural areas in provinces of Zambezi and Manica who have no access to testing facilities, therefore no access to treatment. And likewise in urban slum areas in Ethiopia, difficult for them, they say, to access treatment. They don't have the right clothes. They feel doubly stigmatized. They say it's only poor people now who are getting this disease, as they call it. Increasingly, they understand that if you're middle class or wealthy, you will find a road to get treatment. So the extreme poor are being left behind. And what also staggered me in terms of, not new information, I do know it, but that the fact that it's still true, HIV and AIDS-related illnesses are now, and still are, the leading cause of death among adolescents in Africa, and the second leading cause of death of adolescents globally. Our prevention interventions are not working. We are not supporting effective social behaviour change programs. And a lot of the issue surrounds the fact that it's the structural drivers that continue to fuel the epidemic. Extreme poverty, inequality, especially gender and economic, gender-based violence, injustice in terms of lack of access to treatment, and stigma and discrimination. That is an ongoing barrier to people's capacity and willingness to get tested and get on treatment. The evidence and the science tells us now that early treatment means better maintenance, better sustaining lives and livelihoods. And in Concern's work on extreme poverty, we view health as a primary asset for people's economic and social development.
Yeah, and how long is it that you can have AIDS or have HIV before you get AIDS, you know?
There are many factors involved with this, particularly one's living and social economic environment. Access to food. I always say food is the first medicine to boost the immune system. Support system, in terms of people living with HIV who belong to networks, have better support from peers. support by the affected communities who are supporting people living with HIV, governance, leadership, and non-discrimination of minority groups, including sex workers, people who inject drugs, men who have sex with men, and other minority populations who are unfortunately affected by the risk and vulnerability in terms of transmission and HIV.
How much more euro or dollars needs to be invested every year so that everyone who has a risk can have a HIV test and get on treatment?
Unfortunately, this was new news at the conference, but not unsurprising. Investment by all the major donors is decreasing. Investment in overseas development assistance in general is decreasing, as all countries are now mandated to deliver on the Sustainable Development Goals. So there's the universality of delivery on sustainable development by all countries, rich countries and poor countries. But the recent UNAIDS estimate is that 26.2 billion will be required for the AIDS response in 2020. And the resources are not commensurate with the need. It's true, some governments in Africa are increasingly financing their national response, but not enough is being done in countries distracted with conflict, constitutional issues, governance issues, extending presidency issues, where it's not in the interest of civil society and target populations that local resources are being used for other means. Taxation systems in developing countries still need to be strengthened so that investments in health system strengthening can better deliver on health and TB diagnosis and treatment. This was new at the conference in terms of people are acknowledging the interface between HIV and TB. TB, tuberculosis, is one of the leading opportunistic infections, and it is causing high mortality.
What do you mean by opportunistic?
Opportunistic infections occur when a person's immune system is weakened so that other infections take the opportunity to invade the body, like cancers, TB, diarrhea diseases, malaria even. Anybody with a weakened immune system is open to other infections. And we need to treat the opportunistic infections as well as reduce the viral load through antiretroviral treatment. But food remains the first medicine. Peace building and conflict. South Sudan is one of the countries where concern is working. I'm very concerned about currently, especially with recent outbreak in-country civil fighting. The health system is fracturing, weakening. It cannot test and treat not just for HIV, but for ordinary infectious diseases of mothers and children and men at risk. A lot more needs to be done in supporting countries in maintaining, sustaining, rebuilding peace. A recent Lancet report acknowledged the fact that the leading cause of death for mothers and children in countries affected by conflict is actually conflict now, because mortality and morbidity is exacerbated where conflict is killing mothers and children. And this extends from the Middle East, Syria, Libya, to Southern Africa, to Southeast Asia. Conflict and corruption kill, and especially kill the most vulnerable in terms of women and children. HIV delivery in terms of treatment was interrupted in Sierra Leone and Liberia with the Ebola crisis. So any other issue can literally be the straw that breaks the camel's back in terms of health system delivery.
Where are most of the people who haven't been tested for HIV that it's believed that these people have HIV? What countries do you know, the biggest countries?
The biggest countries remain in Southern Africa, East, Central and Southern Africa. The South African epidemic is still growing, and the fastest growing epidemic more recently is in Eastern Europe and Central Asia. But the biggest burden in terms of sheer numbers is on the African continent, including countries of Kenya, Mozambique, Zambia, Zimbabwe, Botswana, Lesotho, South Africa. HIV has not been halted or is not reversing. Every year there is a new cohort of 12, 13, 14-year-olds. We are not reaching young people appropriately in terms of health and HIV education and supporting them to reduce their risk of contracting HIV and AIDS. We are failing the next generation. We know how to prevent HIV. HIV is technically 100% preventable, but especially most at risk, vulnerable young girls are not being afforded the knowledge, the attitude, and the access to services to prevent them being infected.
Is there anything you want to say about HIV in Ireland and in Western Europe?
Again, it remains a concern that HIV is increasing in Eastern Europe, Central Asia, including Ireland. I just looked up the statistics for this year in Ireland to last week. We're already 300 new diagnosed cases in Ireland this year until July. That's almost between 1 to 2 new diagnoses every day. That means treatment for life. That means money being spent on this is not being spent on something else in Ireland's health system. We've increased by 78 for the same period this year compared to last year. It's exactly the same in the United Kingdom, and I don't know how Brexit will affect it, but the risks and the drivers, again, among young people and men who have sex with men, intravenous drug users, continue to advance the spread. Complacency is a huge enemy of the spread of HIV, and corruption in developing countries. The resources need to be invested, tracked, and governments need to be made accountable. There was some lack of leadership, I would say, at this International AIDS Conference. While ministers for health were there and some related ministries, not many presidents that I'm aware of were at the conference or prime ministers. I need to check it, but as far as I'm aware, I did not see prime ministers or presidents. There was some celebrity attention in terms of Charlize Theron. She gave a great speech at the opening ceremony. Elton John was there, speaking out for the marginalised in terms of LGBTI population, especially in Africa. And Prince Harry, admirably, I believe, it was on television, had a HIV test.
Oh, I saw that.
So, we need more leadership in terms of governments. HIV and AIDS, and the spread of HIV and AIDS, is a developmental issue. It's a threat to development and delivering on the Sustainable Development Goals everywhere.
It'll be, or am I right to say that it'll be a huge achievement when there are more people on antiretroviral drugs than there are people who have the illness who are not on it, or does that make much of a difference to reach that point?
Absolutely. The less HIV there is in the world, the less people are likely to become infected with the HIV virus. Effective treatment with HIV, with antiretroviral medication, reduces the viral load to undetectable levels. The less virus, if I was living with HIV, I had in my body, the less likely I am to pass it on to somebody else. So increasingly at the conference we're hearing talk of treatment as prevention. Effective treatment supports prevention. Anybody living with HIV on effective treatment is less likely to pass the virus on to other people. But as I mentioned earlier, currently 17 million people are on treatment, which is great. We've passed the 15 million mark. But with almost 37 million people living with HIV globally today in 2016, 19 million people are still not tested, not diagnosed, and not on treatment. That is a huge population.
Just to summarise, Breda, after these 2 UN reports and the international conference you were at there last week, if I'm talking to you this time next year, like, what difference would you like to see between now and this time next year? Obviously, all the money is not going to be provided that's needed by 12 months' time. What can the Irish government and the EU do, and what's your message in general?
Well, I think it's important for governments who are supporting international aid and ODA effectively to lead by example in terms of funding the global fund, funding the response. Increasingly,
what's the global fund?
The global fund is a fund that was set up, a mechanism to diagnose and treat the three major diseases of HIV and AIDS, TB and malaria. All countries in the north are investing a percentage of their overseas development assistance into the global fund. It has been very effective in getting more people on treatment, absolutely. It's one pot, the global fund, to diagnose and treat AIDS, TB and malaria. Irish Aid, the Irish government, as with concern, we need to engage greater with civil society in the response for outreach at the community level. This is the first conference where I've really seen nurses engaged and acknowledged in terms of their engagement in the response to date and going forward. Likewise, community health workers. It really struck me at the conference when I saw the graveyard to the community health workers, basically who've been unrecognised and unacknowledged in the response to date, particularly in South Africa. The strapline was disregarded and disrespected. Give community health workers recognition. They can reach the remote rural areas, the urban slum areas. Community health workers know their populations. And without supporting the civil society community response, we will not end AIDS.
And it's important that they're paid well, isn't it? For do that.
Absolutely. Especially in countries where there is very little employment, especially for young people. People need to feed their families. They need to put food on the table. We can't expect community health workers to work for nothing in Ireland or in Europe. How can we expect community health workers to work in poorest countries as volunteers? Definitely, community health workers need to be recruited, trained, supported, supervised, followed up, retained and paid, commensurate with the local salaries in country. They're the unsung heroes and have been, as we saw likewise with the Ebola response to now in East, Central and Southern Africa, because they don't want to see their community members die. I hope that by the time I'm talking to you post the next International AIDS Conference, which will be held in Amsterdam in 2018, that we can show much better progress in terms of preventing and averting new HIV infections. I still believe HIV stands for a human immunodeficiency virus. It stands for hope is vital. There is hope. 17 million people are now on treatment. How can we reach and get to the next 19 million? I hope we're way down that road by the time we're all gathering together to talk at the next International AIDS Conference in Amsterdam in 2018. Thanks, Darren, and thanks 2018. It's every 2 years.
Okay.
Thanks, Darren, and thanks to Near FM for your interest in the International AIDS Conference and the Global HIV and AIDS Response and Concerns work. Thank you.
Okay, thanks, Breda. I'll talk to you again soon. Bye-bye.